Hello everyone, I am Dr. Soha Mukherjee and welcome back to my channel. Today in this video, we are going to discuss psychiatry in just 6 pages. So this rapid revision video is a one-stop solution for you to cover all the high-yield topics in the most concise way, which will be perfect for your upcoming PG and FMG exam. Psychiatry, as you all know, is a minor subject, but it's a very important subject too. If you consider the last FMG January exam, there were 7 questions from psychiatry. Also, in the last PG exam, in both the shifts, there were 6 questions each from psychiatry. So, it's a very important subject and you should target full marks in this subject. And it will be very easy if you follow this video. So, if you're in the last phase of revision or you are short of time, this video is the perfect crash course for you. After watching the video, please put your feedback in the comment section. It will help me improve my videos. Also, if you have any doubts or queries, you can reach me out on Instagram. My Instagram handle is given in the comment box. You can also join my Telegram group, which will help you boost your preparation. The link for the Telegram group is also given in the comment box. So let's start the video.
So our first topic is mental status examination. It's an important question. The question will come like this. What is the clinical exam in psychiatry called? It's called MSE or mental status examination. Now, what are the components of mental status examination? The first component is perception. In perception, we have two types, illusion and hallucination. Illusion means false perception of a real object. Suppose you are walking on a street, you find a snake, but you consider it as a rope. You consider the snake as a rope. So there is a real object present, which is the rope, but you have a false perception of that real object. So it's called illusion. What is hallucination? Hallucination means false perception without any object. You are again walking on a street, you do not find, there is no object present, there is no rope present, but you still find as a snake. That's called hallucination. It can be auditory, it can be like uh, any other hallucination also. This is visual hallucination. What I give you as an example, you find the snake, but it can be auditory also. So what are the properties of hallucination? It always occurs in the absence of any stimulus, like without the presence of any object. It's clear as a real perception. It occurs in the outer and objective space. Now, what is outer and objective space? Outer and objective space means outside your mind. It doesn't happen inside your body. Like I told you, auditory hallucination. Suppose you hear any sound from outside your body. If I ask you, where is the sound coming from? You tell that someone else is speaking from outside. So it's outer and objective space. Now, if the same thing happens in the inner and subjective space, what it's called? It's called pseudo hallucination. If it happens in the inner and subjective space, it's called pseudo hallucination. It's again a question, and it's not under your willful control. You cannot control hallucination. The next topic is delusion. Delusion means a false belief. It's firm and fixed, and it continues despite evidence given against it. So, it cannot be explained by any social and cultural background also. In spite of giving evidence, like the belief is false, the person considers it like the person has a firm and fixed decision against the belief. So, delusion is a disorder of content of thought. It's again a very important question. What is the disorder of delusion? It's a disorder of content of thought. Now, what are the types of delusion? Types of delusion are delusion of persecution. In delusion of persecution, the patient thinks that somebody is trying to harm the patient. The patient presents with complaints like my neighbor is trying to harm me or my wife is trying to harm me. Delusion of love, which is also called erotomania, means the patient considers that someone else, someone stranger is in love with the patient. Delusion of infidelity, which is also called as Othello syndrome or morbid jealousy. Like mainly males have it. The patient will think like the partner is cheating on him. And morbid jealousy, it happens when the patient is having alcohol dependence also. This is important. Like delusion of nihilism. Delusion of nihilism is also known as Cotard syndrome. Here the patient believes that everything is finished, like everybody is dead, his organs have all damaged or all rotten, he is going to die. So all negative thoughts is coming to his mind. It's delusion of nihilism. Capgras syndrome. It's again a very important. Capgras syndrome means the close person gets replaced by a stranger. Suppose the patient is considering his wife has got replaced by a stranger. It's called Capgras syndrome. And it's most commonly seen in which dementia? This can again be a question. Capgras syndrome is most commonly seen in Lewy body dementia. Lewy body dementia. Now coming to Fregoli syndrome. Fregoli syndrome means familiar person has changed the appearance and disguised as a stranger. So that's the difference between Capgras and Fregoli syndrome. What is insight? Insight means awareness of the illness. The patient is understanding. The patient is understanding his own illness. The patient understands that the patient is ill. That's called insight. So if the patient understands that he is ill, that means insight is present. And if the patient doesn't understand that he is ill, the insight is absent. Now coming to schizophrenia. Schizophrenia patients, how will you diagnose a patient with schizophrenia? The patient will have a history of delusions, hallucination, and also according to like how much like the symptoms may last. If the symptoms last more than 1 month, according to ICD-11 or DSM-5, the symptoms are lasting more than 6 months. These two symptoms, then it's called schizophrenia. What is the treatment? Antipsychotics. Now, antipsychotics can be of two types: typical and atypical. Typical antipsychotics are called first generation antipsychotics. Atypical antipsychotics are called second generation antipsychotics. So what is the mechanism of typical antipsychotics? It's D2 blockers, and atypical antipsychotics D2 and serotonin blockers. So the typical antipsychotics are affected against sympathetic, and the extrapyramidal symptoms are much more in typical antipsychotics. In atypical antipsychotics, the metabolic side effects are much more. So what are the side effects? Coming to the side effects, I told you about extrapyramidal side effects. So here are the extrapyramidal side effects. In extrapyramidal side effects, the first one is drug-induced Parkinsonism. In drug-induced Parkinsonism, you will find all the symptoms of Parkinsonism: tremors, rigidity, and bradykinesia. What is the treatment of that? The treatment is anticholinergics like benztropine or trihexyphenidyl. The next one is acute dystonia. It is again a very important question. What is the earliest symptom of acute dystonia? There is sudden contraction of muscle group. Suppose if your sternocleidomastoid muscle is contracted, it will result in torticollis. Again, if your jaw muscle is contracted, it will result in trismus. The treatment is again the same, anticholinergics. The third one is acute akathisia. It is the commonest side effect. Here the patient will have restlessness. The patient cannot sit at one place. The treatment is propranolol, beta blocker. The fourth one is tardive dyskinesia. It's a long-term complication. Here the patient will have involuntary movement of the jaw, lips, like movements like pouting, puckering, or the movement of extremities. The movement of the jaw is referred to as rabbit syndrome. Here, the drug of choice is dopamine depleters. Dopamine depleters like valbenazine. And what we have to do, we have to shift the patient from first generation antipsychotics to second generation antipsychotics. Now the question will come, what is the lethal side effect of antipsychotics? The lethal side effect is neuroleptic malignant syndrome. This is again very important. Neuroleptic malignant syndrome. Here you will find symptoms like fever, rigidity, and increased CPK. So what is the drug of choice for neuroleptic malignant syndrome? The drug of choice is dantrolene. Now coming to the endocrine side effects. The endocrine side effects is because dopamine in our body, it helps to inhibit the prolactin. Now if we block the dopamine receptors, the prolactin will increase and it will result in galactorrhea, menstrual disturbances both in females, and in males it will result in low libido. So these are the endocrine side effects. Now the question will come, what is the treatment of treatment-resistant schizophrenia? You are giving antipsychotics till schizophrenia is present. The drug of choice is clozapine. Now what is meant by treatment-resistant schizophrenia? Treatment-resistant means two different type of antipsychotics are already given to the patient, and out of these two, one is atypical antipsychotics, means first generation. Still there is lack of response, that means it's treatment resistant, the patient is not responding, then we have to give clozapine. What is the side effect of clozapine? The side effects are agranulocytosis, seizures, and myocarditis. So while administering clozapine, we also have to do TLC monitoring. Another side effect is sialorrhea, excessive salivation, and the most common side effect in the exam it will come, it's sedation. What is the treatment of catatonia? Catatonia means, like, how will you diagnose catatonia? The patient will present with posturing. Posturing means patient is doing the same posture again and again. There is stupor. Echolalia. Echolalia means the patient is repeating the same speech. It is already come in previous year question. Echopraxia. Echopraxia means the patient is repeating the same behavior. If all these symptoms are present, you can diagnose it as catatonia. So what is the treatment? The treatment is IV lorazepam. And also we can give electroconvulsive therapy, ECT. Here we are not discussing everything in details. We are only understanding the main topics, the high yield topics, which has the high probability of coming in the exam. Now, what is the prognosis of schizophrenia? What are the good prognostic factors? What are the bad prognostic factors? You can go down the chart and see it. So the symptoms which is acute onset, which has come suddenly, has good prognostic factors, which has come through a long period of time, has bad prognostic factors. Advanced age more than 35 years has good prognostic, less than 20 is bad. Male sex has the bad, female is good. The more the positive symptoms, it's a good prognostic factor. So you can read it once, whatever is there. Next, coming to the mood disorders. Mood disorders, it's mainly depression. So how will you diagnose depression? You will be given these presentations in the question. This present, like the patient presents with sadness of mood, lack of interest in any activity. The patient is having negative thoughts. There is a decrease in sleep, decrease in appetite. The patient is having suicidal thoughts. So all these are symptoms of depression, and these are present for more than 2 weeks. If all these are present 2 weeks, then it's called depressive disorder. So why it is happening? The etiology is monoamine hypothesis. It's still a hypothesis, it's not confirmed. We are considering this due to depression, like depletion of serotonin, norepinephrine, or dopamine. These things are happening. And what is the psychological theory? It's called Beck's cognitive triad. In this triad, the patient has negative view of self. The patient is feeling worthlessness. The patient is also having negative view of environment. The patient is feeling helplessness. And the patient is having negative view of the future. Like the patient is thinking in future also nothing good is going to happen to him. So the patient is having hopelessness. So these three makes Beck's cognitive triad. What is the treatment? The treatment is pharmacotherapy. In pharmacotherapy, we'll again give SSRIs. And in psychotherapy, we'll give CBT, cognitive behavioral therapy. So the previous year question is, in mild depression, we can give both pharmacotherapy and psychotherapy. Whereas in pregnancy or lactation, we can give only CBT. We cannot give SSRIs. This is already a previous year question. Now, what drugs we can give? These are tricyclic and tetracyclic antidepressants. Their mechanism of action is it blocks the serotonin and norepinephrine reuptake inhibitors. Example are imipramine, clomipramine, and amitriptyline. What are the side effects? It blocks the muscarinic receptors, so it has anticholinergic side effects like constipation, urinary retention, dry mouth, decrease in sweating, and it can also cause acute angle closure glaucoma. It blocks the alpha adrenergic receptors. Also, it blocks cardiac sodium channels. So, what does it cause? It can cause postural hypotension due to blockage of cardiac sodium channels. It can cause QT prolongation. Also, it can cause tachycardia. Now, this tricyclic antidepressants has a very narrow therapeutic index. So, if we give in higher dose, it can cause TCA toxicity. It is very important question. So, how can you understand like TCA toxicity has occurred? So, if the QRS is more than 100, we can understand that TCA toxicity has occurred. And what is the treatment? The treatment is alkalization with IV sodium bicarbonate. Also, we can also do, if the intake of the TCA tablets are in like few hours before, we can do gastric lavage with activated charcoal. What are the symptoms of TCA toxicity? The symptoms are hypertension, tachycardia, chest pain, respiratory depression, convulsions, and all the anticholinergic side effects which we discussed here. These are the anticholinergic side effects. Also, it can cause tissue hypoxia, which will lead to metabolic acidosis. In ECG, we will find increased PR, increased QRS, QT prolongation, AV block. Next one is SSRI. SSRI, we can give fluoxetine, paroxetine, escitalopram. The side effects are, most common side effect is nausea and diarrhea. And the sexual side effects are the long-term side effects like low libido, delayed orgasm. Next, there are SNRIs, which are some examples are venlafaxine, desvenlafaxine, milnacipram, levomilnacipram. The side effects are similar to SSRIs, and the most common is hypertension due to blockage of norepinephrine reuptake. Then we can do ECT, electroconvulsive therapy. When we can give ECT? When there is depression also with recent suicide attempts or thoughts. Then only we can give ECT. This is a PYQ. What is the meaning of dysthymia? Dysthymia means when we have mild depressive symptoms for more than 2 years. If the depressive symptoms are present more than 2 years, it's called dysthymia. What is double depression? Double depression is dysthymia along with depression. These both are PYQs. Bipolar disorder are of two types, bipolar type 1, bipolar type 2. In bipolar type 1, we have mania along with depression. Whereas in bipolar type 2, there is hypomania with depression. What are the symptoms of mania? In mania, the mood is elevated, activity level is more, the need for sleep is less, and there is always flight of ideas. The patient will shift from one idea to another. There will be distraction in the patient. If all the symptoms are present for more than 7 days, we can say the patient has mania. What's hypomania? In hypomania, the symptoms are the same as mania, whereas it's less severity and less than 4 days. It's more than 7 days in mania, it's less than 4 days in hypomania. What is the treatment? The treatment are mood stabilizers. Mood stabilizers, the most common one is lithium. We have valproate, we have carbamazepine, and also atypical antipsychotics like risperidone. In pregnancy, what is preferred? In pregnancy, antipsychotics are preferred. Lithium is also good, but we cannot give valproate. Valproate is not allowed in pregnancy. Now, lithium also has a low therapeutic index, so we have to do therapeutic drug monitoring for lithium. In acute mania, the dose is 1 to 1.2 milliequivalent per liter. The maintenance or the prophylaxis for treatment is 0.4 to 0.8 milliequivalent per liter. What is lithium toxicity? If the dose is more than 1.5 milliequivalent per liter. And how will we monitor? We will monitor lithium after 12 hours of the last dose. What is the treatment of lithium toxicity? We have to do hemodialysis. You have to remember this thing. Therapeutic drug monitoring for lithium. Now coming to the side effects of lithium. Side effects for lithium are postural tremors, hypothyroidism, polyuria leading to polydipsia, and teratogenic side effect. The most important is teratogenic side effect. So what is the teratogenic side effect of lithium? It's Epstein anomaly. Epstein anomaly. Now coming to the psychiatric aspects of pregnancy. The most important one are postpartum blues and postpartum depression. What is postpartum blue? Postpartum blue means the patient will have mild depressive symptoms. The onset will be 3 to 5 days of pregnancy. The patient will present with tearfulness, sadness, sleep disturbance, etc. All these are mild. Now, if these symptoms become significant, it's called postpartum depression. The onset is 3 months of delivery. Here, the patient will have suicidal thoughts plus thoughts of harming the baby. Here, the patient is having only depressive, like mild depressive symptoms, but in depression, the symptoms have become significant, and also the patient is having thoughts of harming the baby and suicidal thoughts. In postpartum psychosis, it's much more. The patient will have delusion, hallucinations. The patient will think that she didn't give any birth to the baby is already dead. All these thoughts will come to the mind. Now the topic is suicide. In India, suicide is 12 per lakh population. The most common method is hanging. Next is use of poisoning. It's considered that the level of 5-HI in the CSF, it decides the rate of suicide. So the lower the levels, it increases the suicide risk. What is copycat suicide? Copycat suicide, it happens more in adults. Suppose in a group of adolescents, one person is committing suicide and seeing that the other person is also committing suicide. So it's called copycat suicide. It's a PYQ. What is paradoxical suicide? Paradoxical suicide means the patient was undergoing treatment, and when the symptoms started improving, the patient committed suicide. The most common cause of suicide is depression, and the risk factors are previous suicide attempt, hopelessness, males, age greater than 45 years. These are all the risk factors. The most important one is previous suicide attempt. Now coming to panic disorders. Panic disorders means feeling like this sentence will be given in the question, feeling of impending doom. The patient will think that he is going to die. Then we can consider it as panic attack. So it's repetitive and unexpected panic attacks. If it happens repetitively and unexpectedly, it's called panic disorder. The treatment is pharmacotherapy. In pharmacotherapy, we give benzodiazepine and SSRIs, also psychotherapy, CBT. These are some of the common phobias. It's not that important. You can just go through once. Nyctophobia means fear of dark. Agoraphobia means fear from places which are difficult to escape. Claustrophobia means closed places. You can have a look here. Now coming to important topic, obsessive compulsive disorder. This is an important topic. So what are obsessions? Obsessions means disorder of the possession of thought. Like recurrent intrusive thoughts are coming to your mind. Recurrent intrusive thoughts coming to your mind which causes anxiety. Now the patient considers them as a product of their own mind. Patient understands that this is coming from their own mind only. Sometimes the patient finds this irrational or excessive also. They try to resist, and when they try to resist, they have to perform certain behaviors. This is called compulsion to get relief. Obsessive compulsive disorder is ego dystonic. Ego dystonic means the patient, it's not acceptable to self. The patient is not accepting. What is the treatment? Pharmacotherapy plus psychotherapy. In psychotherapy, we have to give ERP, exposure and response prevention. When the obsession is coming, we have to prevent the patient from undergoing compulsion. In pharmacotherapy, we have to give combined SSRIs and TCA, example clomipramine. And to augment the treatment, we can give antipsychotics. Now coming to body dysmorphic disorder. In body dysmorphic disorder, patient thinks the patient has a defect or anomaly in the physical appearance. So the patient keeps on like looking at the mirror. The patient has a repetitive behavior. The patient keeps on looking at the mirror, and usually the patient thinks that there is an anomaly in the hair, nose, or skin. Body focused repetitive behavior. In body focused repetitive behavior, this is a previous year question. This is the image of the stomach, which is filled with hair. So the patient has trichotillomania, means repetitive pulling of the hair. Trichophagy means the patient eats the hair. Trichobezoar, this is an image of the trichobezoar, means a ball of hair is formed in the stomach. So this image is important. Excoriation disorder means repetitive picking of the skin. Now our next topic is trauma and stress related disorder. So the first one is post-traumatic stress disorder, PTSD. It follows significant traumatic events. It must be significant, like war, flood, or some rape events. The symptoms are the patient will have flashback, the patient will have vivid memories, and sometimes the patient will have nightmares. All these symptoms, if it happens for more than 1 month, we can call it as PTSD. The treatment is CBT. CBT is the treatment of choice, and we can add SSRIs also. Illness anxiety disorder or hypochondriasis means the patient is already having preoccupied, like patient is preoccupied with having a serious illness. Despite the patient is doing the medical test, in medical test patient is absolutely fine, but still the patient is having preoccupied with some serious physical illness. Conversion disorder. Conversion disorder means the patient will have symptoms of motor or sensory or cognitive deficit. But when you do some medical test, or you as a doctor try to understand the patient is not having any anatomical or physiological deficit. Then it's called conversion disorder. One most important question is La Belle indifference. Suppose the patient is complaining to you that he cannot see with one of the eyes, but the patient has lack of concern for the symptoms. The patient is not at all concerned with that. The patient is telling, okay, it's okay. I cannot see with one eye. It's completely fine. It's more common in females. One of the differential diagnoses for conversion disorder is acute intermittent porphyria. Coming to the substance related and addictive disorders. So we have to understand certain definition. Tolerance means more amount is required to get the desired effect, which we were getting at a lesser amount earlier. What is the withdrawal symptoms of alcohol? After 6 to 8 hours, the most common symptom is tremors. You will have nausea, vomiting, hypertension. After 12 to 24 hours, you will have alcoholic hallucinations. After 24 to 48 hours, you will have alcohol withdrawal seizures. After 48 to 72 hours, you will have delirium tremens. It's a very, very hot topic. Many questions have come earlier in both FMG and NEET PG. So what is delirium tremens? How can you diagnose it? So if there is disturbance of consciousness, if there is disorientation to time, place, and person, and if there are visual hallucinations present, you can understand it as delirium tremens. The complication of alcoholism is acute complication is Wernicke encephalopathy. It is due to thiamine deficiency. Here you can remember it as a mnemonic GOA, global confusion, ophthalmoplegia due to sixth nerve palsy and ataxia. What is the treatment of Wernicke's encephalopathy? The treatment is high dosage of parenteral thiamine because it is due to thiamine deficiency. What is a chronic complication? The chronic complication is Korsakoff syndrome. In Korsakoff syndrome, you will have anterograde amnesia. The patient will have confabulations, like the patient will forget in between. And when asked, the patient will try to fill up the memory gap with some false stories. It's called confabulation. It's also due to thiamine deficiency. How can you treat? You have to do detoxification of alcohol. You can do it using benzodiazepines. Also, you have to give thiamines. In the presence of liver damage, you have to give oxazepam and lorazepam. Anti-craving agents are given, naltrexone, acamprosate, and deterrent agents like disulfiram, so the patient will not have the urge to drink alcohol because it will cause disulfiram ethanol reaction. The mechanism is it blocks the aldehyde dehydrogenase. Coming to opioids, the most common one is heroin. It's the most common abused opioid. The state name is MAC, and if it's given overdose, it will cause respiratory depression and death. The treatment is IV naloxone. IV naloxone is the drug of choice for opioid overdose. What are now coming to cocaine? The mechanism of action is it blocks the dopamine and norepinephrine receptors. So if norepinephrine is increased, it will cause vasoconstriction. And if vasoconstriction is happening, we will have symptoms like hypertension and myocardial infarction. Also, patients like the people snort cocaine with their nose, so nasal septal perforation will occur due to ischemia. We will have seizures. There is jet black pigmentation of the tongue. It's a question. You have to remember jet black pigmentation of the tongue due to cocaine intake. Now, what are the side effects? The patient will have tactile hallucination, which are also known as cocaine bugs or Magnum phenomena. Like the patient presents with scratches on the forearm. So you have to understand the patient is addicted to cocaine. The patient will think that bugs are running on the skin of the patient. Now, coming to tobacco. Tobacco is the most common used substance in India. The treatment is varenicline. It's a very good drug. It prevents craving and withdrawal. It's a partial agonist at the nicotinic and alpha 4 beta 2 receptors. Bupropion is another drug. Coming to personality disorders, the first one is borderline personality disorder. So here the patient is emotionally unstable. Long history. So a young female presents to you with mood fluctuations. The patient will tell that the patient had unstable relationships in the past. It will be a long history, like 3 to 4 years. And the patient has self-injurious behavior. You can find the patient raised his cut many times. So the treatment is dialectical behavioral therapy. Don't confuse this with depression. In depression, the patient will have lack of mood. The patient will not find energy in doing any activity. The second one is impulse control disorder. In impulse control disorder, the patient will have failure to resist an impulse, which will it will increase the tension within them. And when they perform the behavior, they will get relief, but later on they will feel guilty. What are some of the impulse control disorders? Pyromania. Pyromania means putting the things on fire. Kleptomania. The patient will steal again and again. Intermittent explosive disorder. The patient will show aggression. Excessive sexual disorder. In males, it is called satyriasis. In females, it is called nymphomania. It's a question. You have to remember this. Oniomania. Oniomania means the patient has excessive impulse to do shopping. So we are already on the last few minutes of our discussion in the last page. Our next topic is eating disorder. All eating disorders are most common in females. The first one is anorexia nervosa. So you can find thin female is looking at the mirror and the patient is thinking that she is fat. Already she is thin, but she is thinking and looking at the mirror that she is fat. So there is body image disturbance. Considering the think that she is fat, she is restricting energy intake, which is resulting in weight loss. The BMI will come lower than 18.5. The patient has excessive fear of weight gain and thus will find signs and symptoms of starvation like amenorrhea. So the treatment, we have to hospitalize the patient. When we can hospitalize the patient? When there is dehydration or electrolyte imbalance or significant weight loss, like less than 80% of the desired weight, then we have to hospitalize the patient. Otherwise, we can give behavioral therapy, SSRIs, TCA, and still if we find that even after giving all the treatment, even after giving the drugs, the patient there is failure to weight gain, means the patient is not taking the medicine. After taking the medicine, the patient is going to the bathroom and doing vomiting. So we have to monitor the patient 2 hours after the meals. After anorexia nervosa, the another disorder is bulimia nervosa. In bulimia nervosa, it's more common in females. There is episodes of binge eating followed by inappropriate ways of stopping weight gain. Like after binge eating, the patient is doing purging, like, or hypergymnasia. The patient is initiating vomiting to reduce the weight, or the patient is using laxatives, diuretics. Then it's called bulimia nervosa. The symptoms are, since the patient is initiating vomiting by putting her finger in the mouth, purging, there will be dental caries, there will be scar on the knuckles of the fingers of the patient. Also, due to vomiting, there will be hypokalemic and hypochloremic alkalosis. These two are important disorders, eating disorders. Now coming to sleep disorders. The most common sleep disorder is narcolepsy. Here, REM sleep introduces into wakefulness. Suppose you are awake and suddenly you feel asleep. The REM sleep, the sleep which brings dreams, in which stage we dream, that phase of the sleep is intruding into wakefulness stage. It's due to the deficiency of hypocretin. The patient will have hypnagogic and hypnopompic hallucinations. Hypnagogic hallucination means while going to the sleep, the patient is having hallucination, and hypnopompic means while waking up from sleep, the patient is having hallucination. Also, there will be cataplexy. Cataplexy means sudden loss of the muscle tone. There will be sleep attack, like sudden urge to sleep. The patient cannot resist the urge to sleep. The treatment is modafinil. It's a question. Now coming to sexual disorder. The sexual disorder, the most common one is premature ejaculation. The question has come from this earlier. So ejaculation less than 1 minute, it's called premature ejaculation. The treatments are SSRI, squeeze technique. When there is ejaculation, before the ejaculation, you have to squeeze the coronal ridge of the glands of the penis. It's called squeeze technique. Stop struts technique. These all treatments can be given to patients with premature ejaculation. Paraphilia means sexual arousal and orgasm is achieved by some stimuli or acts that are deviation from normal sexual behavior. So what are those? You can have a look at this. Voyeurism means watching someone doing sex. Sadism means giving pain. Exhibitionism means showing yourself nude. Masochism means getting pain. So the patient is getting pain by himself or herself and he's enjoying or she is enjoying. Transvestism means cross-dressing. A male patient is dressing like a female. Frotteurism means rubbing the genitals to a stranger. Pedophilia means with a child. Fetichism means with a non-living object. Now coming to child psychiatry, the first one is attention deficit hyperactivity disorder. It's more common in boys. As it's already in the name, the patient will have inattention, distraction. The student roam around in the class, disturbs other students. Hyperactivity means whenever a question is asked, before the question is complete, the student is answering. The treatment is methylphenidate. Now coming to conductive disorders. In conductive disorders, we have two. Oppositional defiant disorder. In oppositional defiant disorder means the patient is like the child is not listening to authority figures, to adults or any authority, to a class teacher who is authority in authority. And in conduct disorders, the child performs some antisocial behavior like stealing, bullying, aggression, cruelty towards animal. So this is the difference between two. Here are a few extra topics like electroconvulsive therapy. Electroconvulsive therapy can be direct or indirect. In direct, we don't use muscle relaxant or anesthesia. In indirect, we use muscle relaxant anesthesia. What is the drug of choice anesthetic? It's methotrexate. What is the drug of choice of muscle relaxant? It's succinylcholine. What is the indications of electroconvulsive therapy? Most common is depression with suicide risk. Not only depression, depression with suicide risk and catatonia. The Mental Health Care Act It signifies that the right of the patient with mental illness and treatment delivery, like all patients have rights for their treatment delivery. For that, they can give advance directive. Suppose the patient is giving in written form, except minors, all persons can write that. Suppose the patient is given a directive after 5 years how the treatment will be going with the patient. Nominated representative, the patient can nominate someone like wife or child that the person will take care or take decisions instead of the patient. Direct ECT is banned in India. ECTs are banned for minors. All direct, indirect, both are banned for the minors, and direct ECT is banned in India. And decriminalization of suicide. This is a new rule. Means earlier, if a person committed suicide and in case the person didn't die, the police can put the person in jail. But now it's decriminalized. So if anyone does a suicide attempt and the person doesn't die, there will be no police case. So these are all the most important topics for psychiatry. I hope this will be a perfect rapid revision before your FMGE and NEET PG exam. If you find any doubts, you can reach out to me on Instagram. The Instagram handle is given in the comment box. Also, you can mention your doubts in the comment box. Thank you.